Thank you, everyone. We're at the end of the conference. The Wi-Fi is down. We are all looking forward to go home. So thank you for joining us and talk about data linkage. Before I do that, I'll introduce myself and the team. I'm Giulia Mantovani, head of Data Linkage Hub in NHS England. This is Mia.
I'm a data scientist, also working in the Linkage Hub and in the Central Data Science team.
This is our team. That's the QR code to our website where you can explore all the variety of work that we do. So during this presentation, we'll cover why you should care about data linkage, how can we get better at data linkage, and so we'll introduce the quality assurance framework for data linkage. We'll also present a case study of how we applied it to a specific project within NHS England, and also what your role can be in all this. So I took this screenshot from the NHS England website because I thought it was representing very well the role of NHS England when it comes to health data. NHS England is pretty much the only place where you can find most of the population national healthcare data. And every year we have so many data access requests from a variety of users. We've got researchers, we've got academia, private companies, other government organizations, and for any kind of application really. And I'm sure that many of you, many analysts at this conference, many data professionals rely on the data that you get from NHS England. So obviously this puts a big burden on NHS England in providing such data. What quality, what level of curation does data have? So obviously there is a big difference in the value of, for example, single data point versus a longitudinal and linked data set. We've learned all about that in not one but two keynotes. Andy Boyd, from the director of UK LLC, and today Emma Gordon from ADR UK. They were all on about data linkage, but just to consolidate, I'll tell you a little story. In September 2017, I found out I was pregnant of my first child, and that triggers a journey into the healthcare system. I first went to my GP, and he booked appointments with the midwife, and then hospital appointments, blood test, ultrasound, more midwife appointments, and in April 2018, my son was born. This journey, even if it's 6 years down the line, is still very clear in my head. I was the patient, and so by definition, I have a very patient-centric view on my journey. But the same is not true for NHS England. All these data points usually are scattered across many different data sets. So the GP notes will be in the primary care data set, the hospital appointments will be in HES, the midwife appointments will be in maternity, and so actually reconstructing that journey is not a trivial task. But if you want to ask questions like, what is the cost effectiveness of a late pregnancy scan on stillbirth, you do need to link, you do need that journey. And obviously, that didn't stop there. There were 2 lines after that. So what if, what circumstances was my son born? Was he born premature? And if so, we heard, again, Emma speaking about e-child, and we know that there is a correlation between if you're born premature and how then you perform in school. So none of this would be possible without data linkage. So data is a means for telling story, but linked data tell better stories. They add complexity, meaning to these stories. Data is also expensive. Collecting data, curating data is expensive. So data linkage also increases your return on investment. And there is so much that depends on that linkage downstream. All the usage of data downstreams depend on having done that linkage well. So really data linkage is not a byproduct of analysis, but it's a critical modeling step that requires an appropriate level of quality assurance. So NHS England, yes, provides data, but we probably have to do better at providing linked data. And when we first started working on this, we realized that there was quite a siloed approach to how we link data. There were pockets of expertise, but we lacked a standard approach to providing a quality product. And that's where we understood that we had to draw from the literature to understand what the standard was for, what a standard approach to quality assuring data linkage could be. And that's where the framework comes from. And I'll hand over to Mia to talk you through it.
So this is our quality assurance framework for data linkage. And this essentially is a guide that's designed to provide a structured approach to managing and assuring the quality of data linkage processes in NHS England. So it outlines the best principles and strategies to facilitate high quality data linkage. So this is now our map to providing a better service to the diverse data customers that we have in NHS England. So many of you who will be customers in the room. And it's really important to emphasize what the quality assurance framework is not. It's not a step-by-step guide to data linkage. It's more of a way to provide an accessible entry point to conceptualizing data linkage and establish a common language and understanding. So the quality assurance framework itself offers support for all stages of the data linkage lifestyle. So you've got from discovery to delivery. And it's advised that the framework should be regularly consulted to make sure that quality assurance principles are baked right from the start of the project. So I'll go on to the next slide. So this is a bit of an overview of what is in the quality assurance framework itself. So the first dimension is data preparation. So obviously this is the foundation for any high quality data linkage. Then we've got implementation. This is where key decision points come in. So deciding how you're going to do your data linkage, whether it's going to be deterministic, probabilistic. Then we have evaluation, so working out exactly what the quality is of what's been produced by the linkage process. And then underneath we have overall considerations. So, this is project management considerations, information governance considerations as well. And there are a couple of pain points to acknowledge here, because obviously this is our kind of perfect world of what we'd love data linkage to look like, and we want everyone to really care about all of these dimensions. But that doesn't necessarily reflect what reality is. And so there are a few things that the framework needs to do for us. So it needs to acknowledge the fact that there's a huge variety in the amount of work that we do as a linkage hub. So we want the framework to be adaptable to handle linkage for completely new data collections. We want it to be able to help in, say, taking pre-existing assets to create new products like CVD Prevent. And we also want it to be able to be used to audit data linkage things that have already happened in the organization. And obviously it's worth acknowledging here as well that assurance is most effective when initiated at the start of the project, but this doesn't necessarily reflect reality. So we want the framework to be something that could be picked up at any point of the project life cycle. Also, to have engagement with the framework, we have to work with a huge number of different stakeholders. So we want the framework to be able to be used by analysts, data scientists, data engineers, people working in data product, and this again emphasizes why it has to be accessible for everyone. And so this is our website on the theme of accessibility. So our quality assurance framework is available for the public. We've got a QR code, which is a little bit small, but hopefully you can scan it. I appreciate that there's been a lot of QR code scanning the last couple of days, but this might be the last one. This is one of the last talks. In terms of the other things that the website contains, so we kind of we hope that this website will be a one-stop shop for good data linkage practice and assurance. So not only does it contain, so you can see on the left, one of the phases in the quality assurance framework. And so this contains the recommendations and RAG status, so red, amber, green for like the level of assurance that you've kind of completed. But we also want it to be a place where analysts who don't necessarily know a lot about linkage can come and upskill themselves. So for example, on the right, we've got a link to our data linkage bias tutorial, which will take you through step by step and help you to learn how to do bias analysis. So hopefully at this point, we've convinced you that data linkage is something that's really important and something to care about. But I don't know, you might be thinking, okay, I know why this is important, but why do I need to engage with a framework? Why do I really need to like think about data quality assurance? And so this is why we really wanted to talk through a real life case study of something that we'd worked in the organization on. So basically, we decided to apply the quality assurance framework to PAVE, which is the patient validation engine. And this is a service that's used by external customers, so for example, academic researchers, to link cohorts of patients to NHS England data assets. So you'll get a set of demographic information that will be submitted to the service and say hospital records will be returned. So at the moment, the service uses our in-house deterministic person matching algorithm. So this takes the master reference data asset, and if a match is found, then it will be returned with a similarity score. What we found when we were evaluating PAVE was that they were using a far higher similarity score as a threshold to return a match. So, for example, my name's Mia, but my legal name's Amelia. If a record had the name Mia instead of Amelia, that would return a lower similarity score. And, you know, you might be thinking, okay, well, that sounds kind of good. Like, only the highest quality matches are going to be returned. Isn't that a good thing? The problem is various studies have shown that data linkage can miss vulnerable populations, or different data quality issues aren't necessarily equitably distributed across the population. And so this means that downstream analysis could be biased without researchers even knowing it. And so to kind of bring to life that bias, I've got an example in this of a PAVE submission that I did a little bit of analysis on. So in this submission, you can see basically the top row is the matches with the highest threshold. So these are the matches that are made with the highest similarity score. And you can see that what I did was I basically recreated a very simple measure, whether or not a patient was admitted to hospital. And so you can see for the top row, the proportion of patients admitted to hospital is 28.5%. However, for the second row, we've got matches with middle threshold. So this includes both the matches that are made with a high score and the low score. And we can see that the proportion admitted drops to 22.6%. So you've got a change of 5.9%, which is obviously, you know, a big difference. So why is that difference there? We found when analyzing the data that actually the population that had sort of the poorest data quality were young men, and so young men are less likely to be admitted to hospital. Therefore, you know, we kind of see this effect. And so I think here it's really important to acknowledge that imperfect data is going to mean that we're going to have imperfect linkage. But unbiased data quality means that we're going to have biased linked data. So it's not our place to dictate the linkage quality returned to researchers, you know, especially if a kind of records are used for a direct care use case, you know, where it's of paramount importance to make sure that trust is retained between the researchers and the patients that are sort of being in part of a study, for example. It might be the case that you want to use the highest linkage quality. But what matters is actually communicating back to a customer so they can make the most appropriate linkage choice for their use case. So whilst the quality assurance framework can't change this bias, we can use the quality assurance framework to provide comprehensive information to users and researchers about what we're producing so they can caveat and add their own adjustments to their work.
Yes, so you have a role in these two. First, demanding high data quality, high data linkage quality, because you all use linked data, whether you are aware of it or not. And sometimes you might not be aware of it because we don't do a very good job at telling you that data set is linked. And so you're the first one who should be demanding high data quality because that demand will drive a response. And also you can contribute to this framework. You can, as long as it remains just a framework on a website, it will have little use. But what really will make it effective will be if, for example, you tell us what you would like to see in there, what could be helpful in making it happen, how we can turn it into a business process, and also adding tools to it. Showed you how we've got some code. What other tools could be helpful to have up there. And it could make it easier for you to actually quality assure your linkage and your linked data. So it's very easy to provide feedback and contact us. If you go on the website, there's a massive contact us button that will raise a GitHub issue. So please feel free to use that. And just some closing thoughts, just to recap what we said. High quality data linkage is of paramount importance and benefits everyone. It benefits analysts, researchers, but ultimately patients. And it unlocks opportunities that were not there before. And ultimately, it improves data safety as well. And everyone plays a part. You demanding high data quality, us hopefully working towards providing that high quality. And you can also get involved and contribute case studies, thoughts, tools, feedback, anything. That's a bigger QR code if you did not manage to scan the previous one. Thank you, and this is all the talks that the data science team did during the conference. If you haven't seen the posters yet, just walk by those as well. Thank you very much.
Thank you very much. I've got a couple of questions come through on the Slido. It's still got the chance to if you want to. The code is 3716942. We do have the microphone in case anybody wants to stick their hand up. So while you're thinking, I will go with the two questions we've had that have come through. First up, did you do any user research when developing the framework?
Yes. We we've got a big list of users that we have engaged and that we will engage, analysts within NHS England, but also a lot of what it's in here is coming from real life scenarios of, right, this is a pain point on delivering this data linkage project, and this is something that could fix it. And also now we are in the process, well, this is also a user research opportunity for us, because here are the users, and there is a way to provide your feedback. We also reached out to ONS. They've got a massive data linkage hub and lots of expertise in there, and they provided lots of feedback as well. So yeah, it's a work in progress, and it will be always a work in progress because it's a live thing, it's a live document, hopefully.
Thank you. I'm going to add one onto myself. Have you got plans for kind of evaluation once it's being used in anger? Evaluation
of how effective it is, or evaluation of a project?
How the effective the framework is.
Yeah. I guess we don't have I haven't thought of it this way, but the way we are looking at it is more like turning this into a business process, as in, because the first thing when we approached, data engineers have a huge play in this as well. And when we approached them, the first thing they said, well, this is great, but how do we actually make this into, how do we bake this into the process? And so I guess the next challenge for us will be to do that and to engage with all these different data professionals that are involved. And then if it gets used and if it gets engagement, then that's going to be a good feedback that actually was helpful.
And we're also using it in-house as well. So we're like implementing it into our projects, and then that's like the best way that we can get feedback on it ourselves, like making sure that it's adding value to our work and helping us sort of assure things even better. So that's another way that we're getting feedback by working with it ourselves.
Thank you. Right, so we've actually now got a few more that have come through on the Slido. So I'll do one more, then pause for hands up, and then move to the Slido again. So the next question is, do you think that we should have data linkage training courses?
have data linkage training courses?
Oh.
Yes.
Yes.
Further expansion on that?
This tool could be seen as a knowledge sharing tool, right? Because we are still working on it, but what we also want to do is expanding each section with lots of, like, we call it the good reads, so references really. We don't have to reinvent the wheel. There is plenty of material out there. ONS has got plenty of things, but there is courses. We ourselves went to courses organized by researchers, experts in the field. So short answer is definitely. And in fact, just yesterday we were talking about mandating a little bit of data linkage training for researchers in the SDE, just because sometimes it's not, these things, when we say that the users, the analysts, should be demanding high data linkage qualities, because we realize that sometimes all of this is very much hidden, and it's probably due to the fact that you didn't, you never stumbled on
these problems before.
These problems, or you didn't read about it, so very much needed.
Thank you. Okay. Any questions in the room? Okay. Oh, thank you.
Hi. My question.
Mic number 2 coming up.
So my question might be a little bit outside of the scope of the project, but like, what do you think is the main source of the poor data quality that can make the linkage difficult? And is there anything that can be done, like, upstream to reduce this problem for analysts?
I mean, yeah, there's so many reasons why there might be data quality issues that lead to these linkage errors. Yeah, I mean, I think, there are some things that we can kind of like acknowledge in-house that are like issues with, say, the in-person algorithm that we have. For example, the SoundX algorithm is something that's used a lot in linkage, and that will create a coded kind of sound of a name. So for example, my name Amelia, if it's spelled with an E, it'll sound pretty similar. So the SoundX scores will be really similar. Now, there might be issues with, say, the way that a name has been recorded that's non-European, that then means if it's been recorded slightly differently and then goes to that algorithm, then the linkage isn't necessarily going to work as well. So there are issues that could come from that. I don't know if there's anything else you want to add, Giulia?
Yeah, I mean, what we did notice that the data quality by dataset, from dataset to dataset, it varies a lot. Understanding where it comes from, I feel we sit a bit too far away from where that happens. But one thing that we can do, and we should do, and it's in our roadmap, is to feed back when we see that data quality being poor. And data linkage catches that, because you will see, like, when you go and clerically review the linkages that got like a low score or that don't look good, you will notice, okay, this is what happened. And when you do that in a massive data set, it will be evident that maybe there is a pattern. That's why, like, monitoring the performance of a linkage is another item in our agenda. So you monitor, you check what's happening, you see a pattern, you feed it back. Now that's the ideal world, but hopefully we're working towards that.
Thank you. There was another question. Yeah.
Thank you. This is really timely and really, really interesting. Because I've been walking around all of these past few days, and I've been thinking, these results are incredible, but how do you know that your linkage is good, and how much stock can I put in these results? Because I don't know how you've linked this data together, or how appropriate the linkage is, and what's been missed. Could you foresee there being like a linkage score that's almost universal, so that whenever we're talking about data, we can say, these results are based on a 90% linkage score. It's followed the framework, it's whatever we've accounted for biases. We can see we have a kind of way of comparing two bits of analysis, or being able to kind of contextualize how appropriate it is to infer kind of conclusions. Can you see that being a possibility?
Universally, no, because I think, so every model will have its own features, its own, so if you, for example, if you take a probabilistic data linkage model, and you get any two scores, and it comes out with a confidence score. There is a confidence score attached to it, 95%. You take another model, other two pairs of records, 98%. You're tempted to think that 98% means that match is better than the 95% of it there, but that's not, unfortunately, statistically true. And so that's why it's also, when we're now doing a piece of work trying to understand what can go out to customers, and we have to be careful, for example, because if we do provide something that we call a confidence score, and unfortunately, NHS England is guilty of that. We did provide in the past something that we call confident, and it's not a confidence, and so we need to be careful now that we are redoing this. You would expect that if I call it a confidence, then that's what that's the conclusion that you might draw from it. But as far as I know, that would be incorrect. So the score, however, that we could provide, and that's something that is a bit hidden but waved into the quality assurance framework, is have you quality assured this project and this linked data set to the right level for the usage that you intended to do. So yeah, we've got we didn't stop on it too much, but we've got the red, amber, green kind of score on each dimension. Something like you're supposed to document your decision process about why you came up with that model. Did you do that? If yes, then that's a green, or like the level that the extent that you did that's a green. And that ultimately will give a score to how well you quality assure that project, but a score in a sense that, yes, this is an excellent match, no, this isn't. Universally, like across all of possible linkages, I don't think that's statistically achievable. Within a linked data set, more so, but yeah.
Thank you. So back to the slide. We've got a couple of questions on here. First of all, is this a paid service, and can adult social care data be connected to NHS data?
Can adult social care data be connected to NHS data?
Yes. And is it a paid service?
Well, there's DARS, I guess. So any person that wants to use NHS England data that has to go via the data access request service, have a data sharing agreement in place, and that's very easy and fast, I hear. But it is, yeah, I believe you have to pay. I've got no idea. I don't work in that area, so I don't know what the price would be. But yes, there is a price attached to it.
But our framework's free.
Oh, yes.
It's all that's all free.
Free and open.
But within NHS England, is it a kind of at the moment or in the future, would you envisage charging a team for the linkage work, or is that not the business model?
I don't. The vision is that everything that comes through every data ingestion pipeline that is going to be created will have in it a step that calls out to a linkage to a reference or master data, so that, and referring to the talk that our colleagues gave earlier today, we are linking everything to a master patient data set At the moment, that would be PDS, the Person Demographic Service. So it's part of the curation and the ingestion and collection of the data set. It wouldn't be an extra charge. Yeah.
Okay, that's very useful. Thank you very much. And then finally, what has been the biggest misconception about data linkage, and what has worked in combating it?
That's a big question.
Right. You want to give us a go?
We did write a blog recently about 6 misconceptions about MPS. I'm trying to think which the biggest one was.
Well, I'd say I guess that big, bold statement that I wrote, that data linkage is not just a byproduct of analysis, as in the misconception there was, well, it's a join. It's a left join on an NHS number, that's not, that's the misconception that we are really trying to fight, because it is a modeling step, and sometimes you don't realize that NHS number does come from a model, and that model will have a bias, and so that's the misconception, the hidden traps.
Yeah, there's a lot more going on under the surface.
Yes.
Okay, thank you. That brings us to the end of this session. So please can we thank Giulia and Mia for a fantastic talk.